Introduction. The thyroid gland lies in front of the neck. Skin incision for its surgery should be horizontal, for better healing and for cosmetic reasons. Branches of subclavian artery anastomose with those of axillary artery around the scapula. Scaliness anterior is important. It may compress the subclavian artery to cause scaliness anterior syndrome. Lymph nodes are clinically important in deciding the prognosis and treatment of malignancies. Contents. There are numerous structures in the neck. For convenience, they may be grouped as follows: A. Glands, thyroid and parathyroid. B. Thymus, involutes at puberty. C. Arteries, subclavian and carotid. D. Veins, subclavian, internal jugular and brachiocephalic. A. Nerves, glossopharyngeal, vagus, accessory, in this chapter, and hypoglossal, described in Chapter 17. F. Sympathetic trunk. It has 3 cervical ganglia. G. Lymph nodes and thoracic duct. H. Styloid apparatus. Glands. Competency achievement. The student should be able to, and 35.2 describe and demonstrate location, parts, borders, surfaces, relations and blood supply of thyroid gland. 8. Thyroid gland. The thyroid, shield-like, is an endocrine gland with rich blood supply situated in the lower part of the front and sides of the neck. It regulates the basal metabolic rate, stimulates somatic and psychic growth, and plays an important role in calcium metabolism. Since it is placed 153 superficially, it can easily be examined. This is the only gland using natural iodine for the synthesis of its hormones, which are stored within the follicles to be used according to the needs of the body. The gland consists of right and left lobes that are joined to each other by the isthmus, Fig. 8. A third, pyramidal lobe, may project upwards from the isthmus, or from one of the lobes. Sometimes a fibrous or fibromuscular band, levator glandulae thyroidae, descends from the body of the ichthyoid bone to the isthmus or to the pyramidal lobe. Situation and extent. 1. The gland lies against vertebrae C5, C7 and T1, embracing the upper part of the trachea, Fig. 8.2. 2. Each lobe extends from the middle of thyroid cartilage to the 4th or 5th tracheal ring. 3. The isthmus extends from the 2nd to the 4th tracheal ring. Dimensions and weight. Each lobe measures about 5 × 2.5 × 2.5 cm, and the isthmus 1.2 × 1.2 cm. On an average, the gland weighs about 25 grams. However, it is larger in females than in males, and further increases in size during menstruation and pregnancy. Capsules of thyroid. 1. The true capsule is the peripheral condensation of the connective tissue of the gland. A dense capillary plexus is present deep to the true capsule. To avoid hemorrhage during operations, the thyroid is removed along with the true capsule. It can be compared with the prostate, in which the venous plexus lies between the 2 capsules of the gland, and therefore, during prostatectomy, both capsules are left behind, Figs 8.3a and b. The false capsule is derived from the pretracheal layer of the deep cervical fascia, Fig. 8.2. It is thin along the posterior border of the lobes, but thick on the inner surface of the gland, where it forms a suspensory ligament of Berry, which connects the lobe to the cricoid cartilage, Fig. 8.4. Parts and relations. The lobes are conical in shape, having A. an apex, B. a base, C. 3 surfaces, lateral, medial and posterolateral. D. 2 borders, anterior and posterior. The apex is directed upwards and slightly laterally. It is limited superiorly by the attachment of the sternothyroid muscle to the oblique line of thyroid cartilage, which is medial to the apex. The apex is related to superior thyroid artery and the external laryngeal nerve, Fig. 8.5. The base is at level with the 4th or 5th tracheal ring. It is related to inferior thyroid artery and recurrent laryngeal nerve, Fig. 8.7. The lateral or superficial surface is convex, and is covered by A. the sternohyoid, B. the superior belly of omohyoid, C. the sternothyroid, D. the anterior border of the sternocleidomastoid. Fig. 8.4. The medial surface is related to a. Two tubes, trachea and esophagus. B. Two muscles, inferior constrictor and cricothyroid. C. Two nerves, external laryngeal and recurrent laryngeal. Fig. 8.5. The posterolateral or posterior surface is related to the carotid sheath and overlaps the common carotid artery. Fig. 8.4. The anterior border is thin and is related to the anterior branch of superior thyroid artery. Fig. 8.7. The posterior border is thick and rounded and separates the medial and posterior surfaces. It is related to a. Inferior thyroid artery. B. Anastomosis between the posterior branch of superior and ascending branch of inferior thyroid arteries. C. Parathyroid glands. D. Thoracic duct only on the left side. Fig. 8.7. The isthmus connects the lower parts of the two lobes. It has a. Two surfaces, anterior and posterior. B. Two borders. The anterior surface is covered by a. The right and left sternothyroid and sternohyoid muscles. B. The anterior jugular veins. C. Fascia and skin. Fig. 8.4. The posterior surface is related to the second to fourth tracheal rings. The upper border is related to anterior branches of the right and left superior thyroid arteries. Fig. 8.6. Which anastomose here? Lower border, inferior thyroid veins leave the gland at this border. Fig. 8.8. Arterial supply. The thyroid gland is supplied by the superior and inferior thyroid arteries. 1. The superior thyroid artery is the first anterior branch of the external carotid artery, Figs 8.6 and 8.7. It runs downwards and forwards in intimate relation to the external laryngeal nerve. After giving branches to adjacent structures, the artery pierces the pretracheal fascia to reach the apex of the lobe where the nerve deviates medially. At the upper pole, the artery divides into anterior and posterior branches. The anterior branch descends on the anterior border of the lobe and continues along the upper border of the isthmus to anastomose with its fellow of the opposite side. The posterior branch descends on the posterior border of the lobe and anastomoses with the ascending branch of inferior thyroid artery. Fig. 8.7. 2. The inferior thyroid artery is a branch of thyrocervical trunk, which arises from the subclavian artery. It runs first upwards, then medially, and finally downwards to reach the base of the gland. During its course, it passes behind the carotid sheath and the middle cervical sympathetic ganglion, and in front of the vertebral vessels, and gives off branches to adjacent structures. See Fig. 9.5. Its terminal part is intimately related to the recurrent laryngeal nerve, while proximal part is away from the nerve. The artery divides into 4 to 5 glandular branches which pierce the fascia separately to reach the lower part of the gland. One ascending branch anastomoses with the posterior branch of the superior thyroid artery and supplies the parathyroid glands. 3. Sometimes, in 3% of individuals, the thyroid is also supplied by the lowest thyroid artery, thyroidea Eimer artery, which arises from the brachiocephalic trunk or directly from the arch of the aorta. It enters the lower part of the isthmus. 4. Accessory thyroid arteries arising from tracheal and esophageal arteries also supply the thyroid. Venous drainage. The thyroid is drained by the superior, middle and inferior thyroid veins. The superior thyroid vein emerges at the upper pole and accompanies the superior thyroid artery. It ends in the internal jugular vein. Fig. 8.8. The middle thyroid vein is a short, wide channel which emerges at the middle of the lobe and soon enters the internal jugular vein. The inferior thyroid veins emerge at the lower border of isthmus. They form a plexus in front of the trachea and drain into the left brachiocephalic vein. A fourth thyroid vein, caucha, may emerge between the middle and inferior veins and drain into the internal jugular vein. Lymphatic drainage. Lymph from the upper part of the gland reaches the upper deep cervical lymph nodes either directly or through the prelaryngeal nodes. Lymph from the lower part of the gland drains to the lower deep cervical nodes directly, and also through the pretracheal and paratracheal nodes. Nerve supply: nerves are derived mainly from the middle cervical ganglion and partly from the